Hey there, pharmacy owners. Dr. Lisa Faast here, and I'm back with another question that I got, and it was actually such a serendipitous question because just earlier this week I was speaking with one of my inner circle members that I work one-on-one with about a synchronization program, and I've been in this obviously this world of pharmacy for a long time, getting old these days. And synchronization has been around for a long time. Bob Lomanick, the original grandfather of it. And there's lots of ways to do sync. I'm not one of those people that think there's only one way to do sync. I personally like sync all throughout the entire month. I like breaking up sync dates all throughout the month. There's other people that want the entire pharmacy synced to one day, and you fill all those massively at once. I subscribe to that there's more than one way to do sync. But I think where a lot of people get stuck with sync. So if you're like, I tried sync and I hated it, it's one of those things like there's a tough climb up the mountain before you're like going down the other side. And so sync is one of those programs that your world actually gets worse, like far worse before it gets better, because it just creates chaos until you get it figured out, right? Like until people are trained and until you hit a certain volume, right? When you start hitting above 30%, getting to 40%, getting to 50% is like life altering from a synchronization standpoint. It can feel like you're just doing more work because it's almost like you have two different workflows. And that's where a lot of pharmacies throw their hands up and stop, where you were so close. Like if you just pushed over the hill, you would be there. As a woman who has given birth to 4 children, it's that point in like in a women's labor. She's like, I'm done. Like I give up. Give me all the drugs, take me into surgery. And they're like, yeah, you're there. One more push, you're over. So sorry for the childbirthing analogy, but that's where my brain goes. So at that moment when you're ready to give up is like when you should keep going. So those of you that have sync, a lot of you have been doing sync for a long time. You've been around a long time like me, but you're not optimizing the sync. So this is kind of next level kind of sync optimization. There's obviously the first one where it's like get as much as people as you can on sync. Start with your patients that are 5 or more scripts, then go down to 4 or more scripts, then go to 3 or more scripts, then go to like syncing families. There's the whole hierarchy of like launching and implementing the sync program. I like to think of a synchronization program as 3 different layers. I always talk a lot about profit lasagna. Everything's in layers. And the first layer is that foundation, right? Like getting your sync program up and going, getting people synced, creating the systems, the checks, whatnot, getting everybody trained. Like that's obviously level 1. So just doing the basic sync program where you fill all of, Mrs. Smith's prescriptions on the same day and, Mr. Brady's prescriptions on his day. That's the basic sync program. When you've got that rolling, you're not done. If you finish there, I think you're leaving a ton of profitability on the table. So there are a lot of benefits of sync that one, sync, the basic one, level 1 sync helps with cash flow. I firmly believe like that's why you should do sync. Yes, it's convenient for patients. Yes, you can maybe better manage, those prescriptions. Yes, you certainly get an operational efficiency type of thing. But frankly, nuts and bolts, what level 1 sync, getting everybody synced as many as possible, it'll help your cash flow because you can now not carry, you could probably have half the inventory and order things as needed for the sync dates. And your cash flow is just going to dramatically change. Like if you have trouble paying your bills and you're a pretty busy pharmacy, there's other things you could do, but synchronizing prescriptions is definitely one of those because it is going to change how you order, and inventory is the largest suck for cash flow. So, but if that's all you do, you're not really increasing profitability. There is a profitability because maybe you're filling prescriptions that otherwise wouldn't be filled and whatnot. There's other benefits, but to me, the main one of that level 1 sync is cash flow. Now, my level 2 sync is adding on supplements for patients. I'm a huge fan, well, not a, I'm a huge fan of fixing drug-induced nutrient depletion. I did drug-induced nutrient depletion as my, third year pharmacy project. I've been on top of this thing for over 25 years now. And so supplements, I think, is level 2 of a synchronization program. So whether you're targeting drug-induced nutrient depletion, like CoQ10 for statins, or magnesium for diabetic patients, or B vitamins for birth control, whatnot, layering like that next clinical level education, selling supplements, is what I consider level 2. And what level 2 does is, yes, it'll help you sell more supplements, right? Like that brings in some cash money. It also makes your patients feel really good. When you call Mrs. Smith and you say, hey, Mrs. Smith, we're getting ready to fill your prescriptions. You're on 2 medications that deplete B vitamins. Do you ever feel tired or a little bit foggy in the brain? And Miss Smith says, yes. You know what? It might be your B vitamins, because your prescriptions are making it to where your body, isn't keeping it. They feel taken care of. Even if they say no to the supplement, or no right now, or, oh, I have some at home, I'll start taking it, or whatever. They feel cared for and loved, frankly, by you, the pharmacy. So that's level 2 is OTCs and optimizing, patients for either helping with maybe even side effects of drugs, like getting, opioid patients maybe on a DocuSage or something like that. So it's like the OTCs and supplements. I like focusing on the drug-induced nutrient depletion just because there's a very clear clinical story for that. There obviously could be other clinical stories for other causes. So that's level 2. You're increasing your supplements. You're making your patients feel really loved. Level 3 of synchronization is therapy optimization, right? This is, and what do I mean by optimizing their prescription therapy? Now, what are you optimizing for? Lots of things. Maybe you're optimizing for the number of pills a patient takes. Maybe you're optimizing for lowering their copays. You're optimizing for the overall profitability of their drug portfolio. But it's therapy optimization. You're optimizing the prescription drugs. And so when you've got somebody synced, you've got them on the right supplements, now it's time to get them on the right prescriptions. It might be de-prescribing. Maybe they don't need certain things anymore. It might be recommending combos, the people who are on lisinopril and hydrochlorothiazide, or, amiodarone, whatever, maybe putting some things together in a combination because that'll lessen their pill load. Could also reduce a copay, right? Because you now change 2 copays into one. It could be optimizing ibuprofen to Coxanto. So Coxanto is a once a day NSAID, so you only take it 1 time a day, as opposed to ibuprofen, which is up to 4 times a day. And Coxanto also comes with a coupon that you can use to help the patient reduce copay. It's also more profitable for the pharmacy, whereas ibuprofen, we know we might make 30 cents on ibuprofen. So it's that next level of therapy optimization that just really looks at the patient and be like, how can I help this patient optimize their prescription therapy for all the different factors? And so that's level 3 of synchronization. The reason you don't do that in the beginning is that takes work. It takes time. It takes attention. And when you're starting sync, you don't want to be worried about supplements. You don't want to be worried about therapy optimization. Yes, you might want the profitability of level 2 and level 3 sync, but the chaos of implementing level 1 is just not the time to do it. You're going to overwhelm your patients. You're going to overwhelm your staff. Like it's just not the time to do it. Obviously, if you're syncing and you see something clinically significant, like, hey, they're taking 2 prescriptions with hydrochlorothiazide. Like we didn't notice that before because they were, getting filled separately or whatever. Obviously, you take care of those issues, but talking about supplements, talking about optimizing their prescription therapy, don't do that in level 1. That is where I see a lot of pharmacies make like the second biggest mistake. The first one is not pushing through kind of the chaos of implementing sync. The second one is trying to do all of sync, like all levels, and do it all at the initial implementation. And it's too overwhelming. Even for the best of staff, it's just a lot. You got to do it in layers. So get your first sync down in one layer, add on the supplements, go through the patients, get them on supplements, then add on the therapy optimization from a prescription standpoint and get their therapy optimized. So that's how I answer the question on how I do sync and how I recommend it to be done, and how you can kind of get past some of those common walls that you might hit. So if you have any specific questions, maybe about certain barriers you might have hit in sync or different ways to do it, feel free to pop them below. I'm happy to help. Those of you in Pharmacy Badass University, obviously you can ask me during office hours, or Coach Mike during implementation hour. He's ready to help you as well. So hopefully that was helpful to you. I think every pharmacy should be doing sync if you're like a retail type of pharmacy, even if you're a compounding pharmacy, right? Like, we should try to optimize and become efficient as well. So it's kind of one of those foundational programs that, does all the things, helps cash flow, helps with profitability, helps your patients feel loved. It's a win-win-win. And it doesn't really cost you anything other than a little bit of energy and time in the beginning, maybe some frustration, but you'll quickly pass that if you keep going through it. So let me know what other questions you have. I'm happy to answer those too. And I'll talk to you guys again soon. Bye-bye.